Hi, how are you? I noticed you were looking at our celiac disease brochure. Would you like me to tell you a little bit more about it? So, celiac disease is an immune reaction to eating gluten, a protein found in wheat, barley, and rye. Who is at risk for celiac disease? First degree relatives, second degree relatives if you have multiple people in your family who have celiac disease. Also, people who have another autoimmune disease and certain genetic disorders are more likely to have celiac disease. Some conditions associated with celiac disease include lupus, type 1 diabetes, thyroid disease, autoimmune liver disease, Down syndrome, Addison's disease, lactose intolerance, intestinal cancer. According to the World's Gastroenterological Organization, celiac disease can be divided into two, which would be classical celiac disease and non-classical celiac disease. In classical celiac disease, patients have signs and symptoms of malabsorption, which include diarrhea and weight loss, or failure in growth in children. In non-classical celiac disease, patients may have mild gastrointestinal symptoms without clear signs of malabsorption. They may suffer from abdominal distension and pain, and or anemia, chronic fatigue, chronic migraines. Diagnosis begins with a physical exam and a medical history to see if you have celiac disease or you need to be tested for celiac disease. Complete blood count, liver functions test, and cholesterol test. The only way to treat celiac disease is by completely and permanently removing gluten from your diet, which will help your intestinal valve heal and start absorbing nutrients properly. Your doctor will teach you how to avoid gluten while following a nutritious and healthy. They will also show you how to read labels on food packaging so you know if something contains a gluten product or a wheat product. Ingredients you should avoid. If you experience symptoms of diarrhea, fatigue, weight loss, bloating and gas, abdominal pain, nausea and vomiting, and constipation, there might be a sign of celiac disease. However, more adults have unrelated digestive system symptoms, which would be anemia, loss of bone density or soft bones, itchy, blistery skin rash, mouth ulcers, headaches, and fatigue, joint pain, reduced function of the spleen. If you feel any of these symptoms or have any of these symptoms, you might want to consult your doctor and get tested for celiac disease.